testosterone, this is my favorite thing. Testosterone therapy is something that we always forget about in menopausal women. And guess what? Testosterone is not going to give you prostate cancer. Did you ever know that? Yeah. So testosterone, I'm just going to be totally honest with you. Yes, we replace a lot of estrogen. But when you are a menopausal woman and you're not making any measurable testosterone, when we've already gone through a few years into menopause, I am going to bet you 25 cents that you are going to be far better with optimizing testosterone and getting you to an optimal range than estrogen. Estrogen is important. Every woman should get estrogen, but you know what? You should get a ton of testosterone.
Doesn't that give women lots of extra body hair?
Oh yeah, you know what? Does it look like I'm shaving a beard or a mustache, or I'm getting a deep gravelly voice, or oh my gosh, I'm building biceps like Popeye? Can't you see that? My testosterone level right now is as high as most men that are coming in to see me for testosterone therapy.
Have you seen an increase in hair around your balls?
I don't think I have any. I don't really think I have any. And guess what? I'm not growing a penis between my legs either, which is even better, right? Testosterone is amazing. So,
what does it do for you?
We're going to go through all of that. So, as a side note, remember we were talking about, there's two schools of thought. As women, we lose 50% of our testosterone production by the age of 20 to 25. Another study, we've lost half of our testosterone production 10 years before entering menopause. Okay? I don't have a crystal ball. I can't tell you when you're going to enter menopause, but I sure can tell you when you're testosterone deficient. I think about this all the time. Think about those young women in their 30s. And here they are, they're the stay-at-home mom, they're the soccer mom, they're driving 3 kids all over to this, that, and the other thing. They go into their doctor and they say, oh my goodness, I'm exhausted, and you know what? If my husband ever touches me again, saying that he wants to have sex, that's it, I'm done. I have no libido, I'm tired, and I'm at the end of my rope. What does that doctor say? Oh, it's okay. You've got a lot at home. You're the maid, you're the laundry lady, you're the grocery shopper, you're the kid raiser, you're the carpool nanny, you're everything. Of course you're tired. How about if we look back and say, boy, I wonder what her testosterone level is. Because I could bet you, here's another bet, 25 cents. I bet you her testosterone level is super, super low. So here's some big misconceptions about testosterone. Oh my gosh, I'm going to get this testosterone and I'm going to turn into the biggest wicked bitch you've ever met in your life. Or, I'm just going to be manic. I'm going to get liver disease. I'm going to grow a beard or a mustache. All of these things are going to happen because I'm giving you testosterone. No, that does not happen. The other thing is it's really interesting. There's another little thing floating around out there that says, oh my gosh, we don't know about safety of using testosterone in female. Oh yeah, we do. Stay tuned. So these are big, big myths about women. Okay, testosterone is a male hormone. Like I said, I'm not shaving a beard or a mustache. I don't have a penis growing between my legs. I don't have any of those things. It does not masculinize a woman. And remember, we only use testosterone in a woman because it's going to increase your libido. There's so many other benefits to optimizing testosterone as a female. Testosterone does not cause hair loss as a woman. In fact, do you know that over 2/3 of all women over the age of 40 will naturally thin their hair for no reason at all. It has nothing to do with hormones, thyroid, oh my gosh, I lost 50 pounds. Or how about these women coming in that have lost half their hair from having COVID? That's a huge issue. Over 2/3 of women will naturally thin their hair over the age of 40. Testosterone is not related to that. Here we go, look at 1942. We started testing uses of testosterone. And we initially started using it in the 40s and later for prevention of peripheral vascular disease. So could it really stop an amputation from somebody developing vascular disease in their legs? In 1953, actually, it was being used for people that were having angina. They were having chest pain from developing cardiovascular disease. 91% improvement in both men and women that were having chest pain associated with angina with use of testosterone back in the 50s. That's pretty amazing, right? Oh, but wait, we haven't been using testosterone that long in women, have we? Yeah, we have. So here's the studies that we were talking about as far as women. Men, you're gonna start losing 1 to 3% of your testosterone every single year after the age of 30. So think of what happens to your testosterone level now when you're 50 and you're 60. You know, you're way in the tank. And then I have the conversation with you, listen, pal, my testosterone level's higher than yours, right? And I'm a female, because men will develop androgen deficiency, and they do go through menopause. So they get grouchy, bitchy, they start getting, you know, the big bellies, sleep disruption, all of that stuff, all of the things that they don't want to live with us as a female. Well, we don't want to live with that as a male as well, right? So testosterone is really, really important in optimizing with both men and women. Testosterone is interesting if you look at some clinical research. So, for example, I was involved in a clinical study that just ended maybe a year and a half or so ago. And what we did was we were taking patients and we were seeing, if we optimize hormones, is there a favorable effect on cholesterol profile over 12 months of using bioidentical hormones? And the answer was yes. Was there a marker that we could measure on these people that showed that we were decreasing overall systemic inflammation with using bioidentical hormones, period, not just testosterone? Yes, we were able to prove that as well. And remember, you know, the patients in my practice hear me talk all the time about increased systemic inflammation. There's the root of all evil of chronic disease. Arthritis, osteoporosis, heart disease, diabetes, cancer, you name it. It's from having elevated levels of systemic inflammation. And we found that we were able to reduce that level with using bioidentical hormones, not just testosterone, but testosterone and estrogen. What else does testosterone do? Very helpful for weight management, body composition. Does not happen right away in females. This is something that takes time with getting you to optimal ranges of testosterone before you say, oh my gosh, I wanted to lose 5 pounds. It took me a week to lose 5 pounds rather than a year. Testosterone is very, very favorable for body composition. It does improve our exercise capacity because it makes us feel stronger and it makes us leaner, which is nice. Here's another issue, osteoporosis in women. So how many women that develop osteoporosis do you really want to give yourself a shot every single day for 2 years to improve your bone density? Or would you rather let me optimize your testosterone? And by the way, I can improve your bone density 8.3% per year. That is out in clinical data now as of last December. Testosterone should be an approved use for women for reversal of bone density issues. Interesting, when I started doing this years ago, remember, retentive internus in, traditional prescriptions, and you're gonna give yourself an injection for 2 years and all that because you have osteoporosis. When I started learning about all this stuff, and I had that came in, probably 5 or 6 women that said, you have got to be out of your mind. I am not giving myself a shot every day for the next 2 years for osteoporosis. Sorry, that's off the table. I'm not doing it. I'll take my chances. I'll break a hip, I'll get a compression fracture, but I am not doing this for the next 2 years. Interesting, not understanding the pathophysiology of all of this, I had 5 or 6 women that I said, all right, listen, here's an option for you. How about if we talk about optimizing your testosterone level for bone density protection and improvement, and let's see what happens over the next year or 2. I very rarely suggested it, with the exception of people that were not going to do any treatment whatsoever as far as bone density is concerned. Unbelievable. When I did their bone density in 2 years, and how many women have completely reversed their osteoporosis, and they've never taken a prescription drug for bone density issues. So why are we not utilizing this when we know that there's clinical trials out there that we can reverse bone density issues with just simply optimizing testosterone? So that's pharmaceuticals. So, if you're somebody that makes Forteo or any of those medications, and now all of a sudden, oh my gosh, we can use bioidentical hormones to reverse osteoporosis, that is never going to be approved by the FDA, no matter how many clinical trials that we do, because big pharma are huge lobbyists in our government. And you see the commercials. Every other commercial is on a pharmaceutical drug and why you should take it, right? So testosterone is never going to be officially approved for the use for reversal of bone density issues. And it's too bad, because it's better than any pharmaceutical drug that I've ever used. It improves insulin resistance. When we're leaner, we're stronger, our body composition is better, we're reducing overall systemic inflammation. We reverse insulin resistance. And what happens when you become insulin resistant and you don't try to turn that around? All right, now you're going to develop diabetes. And now we can give you 1, 2, 3, 4, 5, 6 prescription drugs so we can reverse this. So testosterone is very helpful for that. When we talk about reversing coronary artery disease with testosterone, that's a little bit of a tricky concept there, because there's a TRAVERSE trial that's out there now that was just released that shows, guess what, we need more studies that are done on testosterone to show that it really is reversing your risk of developing cardiovascular disease, particularly as a man. We know estrogen, we're already going to get some nice added benefit and protection as a female for reducing our risk of cardiovascular disease. But what does adding testosterone do for us? We're not quite sure through clinical trials that we can reverse coronary artery disease, but we know for people who already have heart disease, and they have that loss of that squeezing and contractility of the heart muscle, and then the fluid backs up in the lungs, and it's called congestive heart failure. Using testosterone therapy in those patients improves the squeezing and the contractility of the heart muscle. We do know that. That is known through clinical trials. But there's still more clinical trials that need to be done as far as reversal of coronary artery disease. Oh, we're getting to you, pal. So, Testosterone protects 4 areas: brain, heart, bones, breast. I'm going to show you a study that's been out for a gazillion years now. This is about using testosterone in females. And do you know, remember, hormones are taboo, right? We're going to give you breast cancer if we give you hormones, right? Do you know that there's a clinical trial out there now that shows that after 10 years of using testosterone therapy in a female, that I've reduced your risk of developing breast cancer by 38%. And guess what else? When I added estrogen to you for another 10 years, I did not increase your risk of developing breast cancer. Very interesting. So, this is good. So we know, and this is not just women, but it's women and men. So low testosterone, I can tell you, a man, if your testosterone level is less than 350, I can pretty much guarantee you that you are going to have short-term memory loss as you age. Same with us as women. Testosterone deficiency, we have no protection as far as short-term memory loss or development of dementia as you age. That's how protective it is on the brain. We already talked about that. We know that this is good for our brain, it's good for our heart, it's good for our bones, reduces risk of fractures, things of that nature. And remember, decreased testosterone, increased levels of systemic inflammation. What happens? Diabetes, right? No possible increased risk of developing breast cancer with using testosterone, but there is when you have no measurable testosterone like I did. So, and these are all proven by clinical trials.